All right, well, welcome you guys tonight. Dr. Miaken Zeigler, and I think tonight is a really great topic because when we get into the stats of low back pain, you'll understand, why it's such an important conversation. And I first want to thank you for taking the time to be here tonight and really investing in showing up, because who knows what you've gone through or been through to really devote the next 30 minutes with me to dive into a topic to better inform and educate yourself. And really that's my goal, is that you join me tonight with an open mind and an open heart, and be willing to just learn and see how you can engage yourself in a way where you can take something away from this to better yourself. So I just muted everybody. I hope that's okay, just because I want to make sure you guys can hear it. So for the conversation in low back pain tonight, we're going to be covering a couple things. First, I want to cover the anatomy of the low back. And then I want to get into some of the statistics that we see with low back pain, how we've commonly treated it in this country, the results of that, and then give you some common ways people generally injure their low back while at home. Look at how low back pain relates to the brain, and then cover some ways you can be proactive about it and protect yourself. So let's get started. I want to make sure you guys can see me here, but I do want to start by talking about the spine, okay? So right now we're looking at the spine. I want to make sure you guys can see me. I'm dealing with, my laptop camera. If you can't hear me, just let me know. But here's your head. You have 7 vertebrae through your neck, 12 to the mid back, 5 through low back, and then here's your pelvis. So when we're talking about the low back, we're talking about these 5 vertebrae in your spine and your pelvis. And your pelvis is made up of your sacrum and your ilium, okay? And here's your tailbone at the end. But what we should see with a healthy low back is we should have these 5 vertebrae. It's called your lumbar vertebra, your low back vertebra. And you should see this curve. It's like a C shape, okay? The curve in your neck and the curve in your low back should match each other. But when you have this C-shaped curve, which is called a lordotic curve, if you look at the discs in the front here, you see how those discs are nice and thick and plump, okay? When you have those nice, thick, plump discs, what it allows for is these joints in the lumbar spine to have all the space they need to exit out and support the lower half of the body, support all the organs in the, the pelvis and the core. So if you get changes with these curves, and I'm just going to give you an example. When you get changes with these curves, you can see how it can put pressure on those discs in the lumbar spine, but it also can change what's going on with the joints back here through the lumbar spine, okay? So these curves are really important because they act as a spring for gravity, and gravity is always working on us, okay? That's what makes our bodies amazing, is that we have stress and gravity always working on us, and we don't necessarily experience or feel if there's any type of stress to our system until we get long-term into life. And so what research has shown is there's a couple different research out there, but one says that our spine should maintain healthy bones and healthy structure between 80 and 100 years. Another research, some other research indicates it should be up to 130 years. And that's only if we take care of our spine and move our spine in a healthy way every day, starting at a very young age, right? And we were taught to take care of our teeth, brush our teeth, morning, night, floss it multiple times a week, maybe every day, at a very young age, right? That was, you know, ground into our brain and into our routine of self-care. A lot of times we don't know how important taking care of our spine is until we are in pain. And so we see degeneration and breakdown happen within a spine much earlier on than 80 to 100 years. So let's talk about these discs here. Okay. So these discs in the spine are really important. They're made up of fibrous material. And on the inside of the disc, there's what's called a nucleus. And that nucleus is made up of gelatinous, gel-like material, okay? And this acts as shock absorption, right? It gives us spring and supports our structure. So when we have breakdown that happens in our spine, it can impact the disc, it can impact the bone, and it can impact our nervous system. But let's take a step back. Why would we have breakdown that happens? One of the worst movements you can do for your lumbar spine is go into flexion, okay? So when you go into flexion, you're putting a lot of stress on these lumbar vertebrae, on these discs, and challenging the joints in the spine. Not only is flexion challenging for the lumbar spine, but also twisting, okay? So if we're twisting back and forth, that is also a detrimental or really hard movement that you do to your lumbar spine. And so anything that puts you into that flexion and that twisting movement can be a problem. So let's just talk about that for a second, because what types of movements will put us into that forward flexion and that twisting? Here's an example of one. We're coming up on winter where we're expecting it to snow. So we have our shovel here, and anything that has us bending forward, right, lifting, and then twisting is the worst movement you can do for your lumbar spine. And what people don't think about when you are shoveling is that shoveling is a workout. It is an exercise. And so you need to prepare your body for exercise and movement, especially movement that's going to put stress to your lumbar spine. So what other movements can you go through day to day that will put your low back into flexion and twisting? I don't have one here, but what about a vacuum cleaner, right? With a vacuum cleaner, you're bending forward and then you're twisting, right? Bending forward, twisting. Also with sweeping, sometimes you're bending forward and you're twisting back and forth, okay? It's fall right now. Raking, we're bending and pulling and twisting. Those are typical movements we see when we are at home doing everyday chores and activities that can put our lumbar spine and back into stress. And when we do that, oftentimes I hear from patients who say, you know what, I was just putting my foot into my pants, or I was just bending down to grab, something off the floor, and that's what did it. That's what put my my low back, that's what blew out my low back. And was it the putting your pants on, or was it lifting, that object or that toy off the floor? Probably not. But it was the cumulative impact of those stresses over time that it was just that movement that did it. The straw that broke the camel's back, so to speak. And so typically we see breakdown happen because of micro traumas that take place over long periods of time. And so when we talk about degenerative changes or stress in our spine, right? It happens over long periods of time. By the time changes show up on X-ray, researchers have estimated that the stress has been there between 5 and 30 years, okay? And typically the first change we get, phase 1 degeneration, is where you get changes of the curve, okay? So anything from normal is phase 1. Phase 2 is where we start to see disc space or disc changes. And that's what I want to get to next, okay? Because a lot of people think that disc bulging and disc herniation are the same thing, but they're actually very different. So when you have biomechanical stresses that are pushing down on a lumbar spine, okay, and those are abnormal stresses, it can push a disc one way or the other, okay? And I want you to think about a disc like a jelly donut, okay? So you've got jelly donuts between each vertebra of the spine, and if you have abnormal pressure being placed on one side or the other, it's going to push the jelly one side or the other. Now, a disc bulge is where you have abnormal compressive forces taking place, and it's pushing a disc, that jelly, to one side or the other. But it's still maintained within that fibrous tissue of the disc. When you have disc herniation, that's where you have complete disc compression, okay? And that disc compression is so much that the jelly within this disc has completely blown out and is now taking space up in a spinal cord, along the joints, but putting stress on a nerve and a spinal cord. A disc herniation is much more significant in terms of its impact to the spinal cord, but a disc bulge or a disc herniation can be both impactful and both painful. The other thing is they used to think that, you know, the discs had no pain receptors, so it didn't really matter what happened with the disc. But what research is showing us now is that there are many pain receptors within your discs, and discs can create a lot of pain. So when you have low back pain, it can come from a disc. It can come from a bulging disc. It doesn't necessarily have to come from the joints back here. So, so again, just covering just a few things is the most common way we can put stress and damage the low back is anything that puts us into forward flexion and rotation. So the less you do, or the more cognizant you are of your posture and reducing those forward flexion movements, especially forward flexion twisting with lifting weights, right? So if you're at the grocery store and you're grabbing your groceries, that can put lumbar spine into some pretty significant stress. So thinking about how you're carrying yourself is really important. Another thing that I typically see men do is they like to sit on their wallets, right? They have their wallet, it usually goes in the back pocket. If you're right-handed, usually goes on the right side, left-handed, usually left. If you're sitting on a wallet, right, whether it's a 1/2 inch all the way up to a George Costanza, you know, 4 or 5 inch wallet, right? That will cause stress to the pelvis. And a lot of times I see, you know, if we are working at a workstation, people are sitting for extended periods of time. So that is long-term stress to a pelvis that is automatically creating compensatory factors in a lumbar spine where if this is shifted to one side, guess what? There has to be a compensatory factor that takes place up higher to maintain a balance. So, and really the worst position for your lumbar spine is sitting. Sitting loads the low back. There should only be, when we look at the segments of the lumbar spine, between 5 and 7 degree rotation. So when you're sitting, it's loading the spine. You add any forward flexion, and then you add into a twist. That's where we get into major problems. And so I want you to be cognizant about your movements and chores at home, because that's where a lot of times we do the most damage. So let's get into some of the stats for low back pain. So low back pain worldwide is the single leading cause of disability. And it's one of the most common reasons people miss work. And in fact, it's the second most common reason people visit their doctor's office, which is outnumbered by upper respiratory infections. So understanding that it's the single leading cause of disability, it's the single leading cause of disability, and it's one of the most common reasons people miss work and go to the doctor. Understanding where this low back pain comes from and how you can minimize it.
Feedback.
Yeah. If everyone can just mute themselves.
Yeah, but I can't, of course.
Okay, there we go. Thanks, Jim. Yeah, where's that coming from? Okay, we'll see if that works. So half of all working Americans admit to having back pain symptoms every year. And experts estimate that over 80% of the population will experience back problems at some point in their life. Okay. The most common case of back pain is mechanical. And what that means is it's not caused by an infection or cancer or some serious condition. It's caused by the movements and activities that we do on a day-to-day basis that put poor biomechanical pressure on the lumbar spine over time. That's most commonly why we see back pain. Okay, so it's not due to a serious condition, it's how we carry ourselves, how we move, the postures we take on. And when you're talking about the spending on healthcare dollars, we're spending around $50 billion every year on back pain. And when you take into account lost wages and the decrease in productivity, that jumps up to $100 billion. So low back pain is experienced by many people in this country, and it costs us a lot of money. Okay, so when we look at how majority of people receive treatment through low back pain, especially if you're going to your healthcare provider or your general practitioner, you know, most of the time the tools that they have to address low back pain are medications. If that doesn't work, they look at cortisone injections. If that doesn't work, then they look at surgery. I mean, that is really the three common, I guess, tools that they have. Well, and I guess I don't want to leave out PT because they will also recommend PT to, to their patients. But low back pain is the most common reason for opioid prescription. I think we've all heard about, the opioid pandemic that is going on in America. In Ohio, I think 8 out of 10 people die every day from an opioid addiction, right? And 80% of people who use heroin first misuse prescription opioids. They can no longer get their pain meds or pain prescriptions, so they turn to, heroin. Because I'm talking to folks who go to chiropractors, I love to look at, how chiropractic approaches the low back pain piece versus when we're looking at, prescription drug use. But chiropractic care uses the same receptors as opioids, providing the same pain relief without addiction, death, or other side effects, right? We talk about the side effects of chiropractic as being able to move better, to be able to sleep better, to have better focus and concentration, better ranges of motion, right? Side effects are very different compared to some of these prescription meds we're talking about. And this is based off of neck pain, but said compared to primary care physicians for management of a neck pain, chiropractors are second most often consulted, and People who see chiropractors, lowest rate of opioid prescriptions, lowest use of advanced imaging like MRI, CT, those sorts of imaging, which can be really expensive, lowest referrals for injections, and lowest use and referrals for surgery. And in fact, in this study, the number was 0. So if anyone knows how much surgery is when you're looking at the neck or the cervical spine, they estimate on average around 100,000. And that's for the surgery and, you know, the rehabilitation around the surgery. But after that, you know, there's cost to, you know, continuing that work to support your body, because they now have diagnostic codes for pain as a result of surgery, right? So we're looking at how many people have low back pain in this country and how we are treating it and how much money we're putting away towards it. I think there's a better way to do it. And so kudos to you who are showing up every day and getting chiropractic care, because it's not only addressing low back pain and poor mechanics in a lumbar spine, helping stop any degeneration that may be taking place as a result of those biomechanics, but it's also improving your health and well-being long-term, which is really amazing. So let me see here. That jumped. Oh, I think this is one study that I found out of spine, and I found this to be interesting. So they were looking at this group of people, and they wanted to see how many years were these folks in chronic spinal pain, okay? And they looked at if you addressed it with drugs, if you addressed it with acupuncture, if you addressed it with chiropractic, what were the results? And I just find it interesting that, you know, they nearly doubled, you know, the folks who saw chiropractors, their chronic pain was going on double the time that the folks who, you know, were in the category of using drugs and using acupuncture as a treatment modality. But let's take a look at this. So the percent who were asymptomatic, so pain-free in 9 weeks, 5% on drugs, 9% on acupuncture, and 27% with chiropractic. And this is people who 8 years chronic spinal pain. I would say that's pretty good. Percent of folks who had adverse effects, we saw 6% who were taking drugs, and then acupuncture, chiropractic was really great in terms of 0 side effects. And then the overall percentage of improvement, general health status. We saw 18% with drugs, 15% with acupuncture, and nearly 50% with chiropractic. So when you're talking about improvement in general health status, those are the measurements of function. How are you moving? Are you able to engage in your activities of daily living? How are you sleeping? Are you able to have focus and clarity? Be able to be productive at work? I mean, I would say that's pretty dang good after experiencing 8 years of chronic spinal pain. So there is most definitely a return on investment when you are investing in your health and your spine through your chiropractic care. So, yeah, we're doing on time here. I want to show you this video because we talk a lot about low back pain, your brain, and chiropractic. And I love talking about how your brain plays a major role in your adjustments. And here is just a short video. It's about 3 minutes long. And it's going to tell us how our brain is impacted, or what's going on with the brain when we have any poor biomechanics. So let me just pull this up so we are ready, and then I'll share my screen with you. See if it'll take me to that. Let's do this. Thanks for your patience with me tonight, you guys. I appreciate it. Okay, so Going to share the screen here. Share my sound and share this.
After many years of research, we now know beyond a doubt that spinal function impacts and changes brain function. Scientists call these changes that happen in our brains neural plastic changes. Neural plastic changes are happening all the time because our brain is continuously adapting to our ever-changing environment. When your spine is not moving properly, this leads to changes in the way the small muscles closest to your spine and skull send proprioceptive information to your brain. Proprioception means your brain's awareness of the position of your body. So it's your brain's ability to know where all the parts of your body are in space. The proprioceptive information that comes from the muscles closest to your spine and skull help your brain to know what's going on in your spine, which represents the core of your body. For your brain to accurately move your arms and legs, your brain needs to know exactly what's happening in your spine. This ability to move accurately, based on sensing what's going on in your body, is a process known as sensory-motor interaction. Sensory-motor interaction basically means your brain's ability to take all the information it receives from your body and your environment and put it all together to make sense of it, and then to create just the right sort of movements in response to that sensory information. For example, moving your hand to catch a ball that has been thrown to you. But how does this relate to your spine? If we look at spinal function in a very simplistic way, there are really three things you want your spine to do on a regular basis. Sometimes, for example, if you're running, you want your spinal bones to move in a synchronistic or harmonious manner to disperse the forces generated from the running. By moving in harmony, the forces are shared equally across your spinal bones so no damage takes place. But other times, for example, if you are lifting a heavy object, then you want your spine to stiffen up to protect you. Without all your muscles stiffening up like this, you could injure yourself. So how does your spine sometimes move and sometimes stiffen up? Well, your brain does this for you by activating the muscles around your spine and skull, which are called your paraspinal muscles. Your brain activates the correct muscles in the correct order, to the correct degree, with perfect timing, to either allow for synchronistic movement, for example during running, or to allow your spine to stiffen up, for example during heavy lifting. In addition to this, your spine muscles also, at times, need to automatically respond during times when you're expecting some sort of postural challenge, such as a trip or a slip. If you are tripping over, you need your brain to automatically, without consciously thinking about it, switch on and off your correct paraspinal muscles very fast to help you maintain your balance and stop yourself from falling over. This automatic activation of your spinal muscles is also important during arm and leg movements to stabilize your body and prevent injuries. So when you have spinal dysfunction, or what chiropractors call a subluxation, your brain is simply not controlling the movement pattern of a part of your spine appropriately. For example, your brain may not be moving your spinal bones in harmony when it should do, or it may not automatically be responding to postural challenges at the right time. So how would you know if you were subluxated? Well, often you don't know because you might not feel any symptoms right away. They may end up causing neural plastic changes in your brain that lead to back or neck pain, but they may not. For some people, they may result in clumsiness because you're not controlling the movements of your body properly. For some people, they may just cause weak muscles, or reduced sports performance, or difficulty reading, or simply the worsening of other conditions such as colic or bedwetting, or perhaps high blood pressure. We simply don't know yet how a subluxation is going to affect you. But we do know when your spine isn't functioning well, If you're subluxated, it does interfere with the way your brain and body communicates, and the way your brain controls what's going on in your body. When a chiropractor adjusts these subluxations and improves the function of your spine, this results in better communication between your brain and your body, which may have an impact on the way you feel if these subluxations were causing symptoms for you. Or it may mean that your brain is better able to control what's happening in your body, so you can perform at your optimal potential. So if you want to have a tune-up of your brain-body communication, go and see your family chiropractor and have your spine tuned up so you can function at your best.
Okay, so I know that was maybe longer than I had mentioned, and now it's already 6:20. But what I want to share with you, especially when it comes to low back pain and talking about chiropractic, I mean, I thought that that video was really wonderful because it gave you an idea of how the brain plays a role in your ability to process what's going on around you with your movements. Where do you need stiffening or do you need stabilizing with what your movements are? And so when you're getting adjusted, it's not just addressing the biomechanical stress that's going on in the lumbar spine or in your vertebra. It's actually altering the brain's ability to process and support your body and your musculature in a better way so that you can be more adaptable and resilient and move in a healthier way during life, during all of activities, which is really powerful and wonderful. I mean, it's not just biomechanics, but it's neurology and changing how your brain responds and processes information. And so that's where I would go from here, is just understanding when you're getting adjusted, how it impacts the spine, but also how it impacts your brain. And then taking into account the movements that you're doing day to day that may be causing increased stress to your lumbar spine with the flexion, the rotation, the flexion, lifting. Those things put stress on a lumbar spine. If you're sitting for extended periods of time, that puts stress on a low back spine. So when you're getting adjusted, when you're doing your spinal hygiene movements and exercises, when you're taking care of your body, you're supporting a healthier structure and spine, not just today, but years from now. And you can bypass, potentially what a lot of other people are experiencing with low back pain and having to be on prescription drugs or shots or surgery or being out of work because it does cause significant disability. So good job to you guys for being here tonight, showing up and understanding more about, low back pain, where it comes from, but then also understanding how your chiropractic care can play a major role in better biomechanics and better brain activity. So I appreciate you guys. I'm sorry that I went over tonight, but know that I will support you and give you more details and tools when you're here day to day for your adjustments. You guys are amazing. Love and appreciate you guys.
All right, have a good one.
Thanks, Jim. Thanks for being here.